progressive, respectful, mentoring, compassionate. These are the values of Palmdale Regional Medical Center. And now we proudly present Palmdale Regional Radio. Here's Melanie Cole.
Patients with severe asthma may get the relief they need with bronchial thermoplasty. My guest today is Dr. Young Ko. He's a pulmonologist and a member of the medical staff at Palmdale Regional Medical Center. Welcome to the show, Dr. Ko. Tell us a little bit about bronchial thermoplasty and how it can help patients with severe asthma.
Bronchial thermoplasty is a treatment for severe asthma approved by FDA 2010. In this country, asthma, about 25 million population, so-called severe asthma, 5 to 10% of them, they are not responding well to conventional medication treatment for asthma. So bronchial thermoplasty came out. It showed a very effective, safe treatment for this severe asthma patient. Through the bronchoscopy, we put a special catheter. This catheter delivers the radio frequency heat energy to the bronchial wall. By doing that, they reduce the smooth muscle thickness in the bronchial wall. By doing that, they control the asthma well. This smooth muscle actually causes a powerful constriction during asthma attack. They shut down the air passages. So this bronchial thermoplasty is basically very effective. So far, 5-year study showed a safe, effective treatment.
So then what's involved in it? What is it?
Patient has to come to the hospital and 3 different sessions with a bronchoscopy in the operating room or in the sedation room. And then through the bronchoscopy, we put a special catheter. This catheter delivers the radio frequency heat energy to the bronchial wall. By delivering heat energy, they decrease the smooth muscle thickness in the bronchial wall. By doing that, they control the asthma well.
And how well do patients tolerate this?
Patients tolerate it very well, this one. So far, nationwide, internationally, nobody died of this procedure, the safe procedure. Actually, also, treatment result is, so far, 5-year study came out, very impressive, as a matter of fact.
So just give us a little lesson about what happens during an asthma attack, Dr. Ko.
During asthma, the patient is very short of breath, chest tightness, they are missing from the school work. They couldn't perform their normal daily activities. So far, there are many medications. They control the asthma relatively well, but so-called severe asthma, like so-called 5 to 10% of asthma population, they are not responding well to medication treatment. So new treatment has to be developed. So that's why bronchial thermoplasty developed. It was approved by FDA 2010, and last 3 years we've been doing bronchial thermoplasty in Palmdale Hospital. So far, patient is very happy, pretty effective.
And does this reduce asthma attacks so that they have fewer need for oral steroid treatments and the side effects with those?
Yeah, exactly. That's what they're doing. By doing this treatment, the requirement of asthma medication is much less. And also, there is a study I can quote the data. 5-year data so far showed a 32% reduction in asthma attack after bronchial thermoplasty, 84% reduction in emergency room visit, and 66% reduction in missing from school and work, and 73% reduction hospitalization from asthma attack. So very impressive results so far.
And can it complement the current treatment to help with the quality of life? Is it one or the other? Can they work together?
They work together. Even though you are doing bronchial thermoplasty, you still have to continue the bronchodilator medication. So they work together, supplement each other. They control the asthma better.
Are there some people, Dr. Ko, who are not candidates for bronchial thermoplasty?
There's no absolute contraindication in bronchial thermoplasty, but some cases, like a patient with COPD and also bronchiectasis, some cases we have to be more careful, but usually this is mainly for adult severe asthma population not responding to medication treatment.
And how long does this last? Is it something that they have to come back in and do again?
so far, a study does not show the has to be repeated. But so far, a study came out, 1 year study came out, very impressive results. But their 5-year study recently came out that benefits sustained 5 years. So it may go more than 5 years, but still study data is not available at this point.
And does it affect the actual asthma attack as they happen? I mean, you can still get an asthma attack after this procedure, yes, but just not as many?
That's correct. Much less. And also requirement of a bronchodilator, steroid inhaler treatment is much less after having this medication, after having this treatment.
What about the severity of the actual asthma attack? Is that reduced?
That's correct. Also, severity is reduced.
Wow, that's absolutely amazing. In just the last few minutes, Dr. Ko, give people with severe asthma your best advice about severe asthma and bronchial thermoplasty.
That's correct. So this bronchial thermoplasty is mainly for adult population and the severe asthma patients not responding to usual medication, bronchodilator and steroid. Then they should consider this bronchial thermoplasty. It's a safe, effective procedure.
And then tell us, why should they come to Palmdale Regional Medical Center for their care?
At this point, Palmdale Hospital is the only hospital they have a bronchial thermoplasty in this area.
Wow, that's absolutely fascinating. Thank you so much for being with us. You're listening to Palmdale Regional Radio, and for more information, you can go to palmdaleregional.com. That's palmdaleregional.com. Physicians are independent practitioners who are not employees or agents of Palmdale Regional Medical Center. The hospital shall not be liable for actions or treatments provided by physicians. This is Melanie Cole. Thanks so much for listening.